Good evening. I'm Mike Fortune, and I will be your host for this our weekly virtual town hall meeting concerning the COVID-19 emergency here in the city of Hamilton. We welcome everyone watching and listening on Cable 14, 900 CHML radio, and on the City of Hamilton's YouTube channel. We would also like to welcome viewers watching on your TV in Burlington, as well as those listening to these weekly town hall events on their telephones. Tonight, we will update you with the latest information about the COVID-19 emergency here in Hamilton, and we will answer as many of your questions as possible. And as usual, joining us this week are Mayor Fred Eisenberger, Mr. Paul Johnson, Director, City of Hamilton's Emergency Operations Center, and of course, Dr. Elizabeth Richardson, City of Hamilton's Medical Officer of Health. As always, we also welcome your participation in tonight's town hall meeting, and you can submit questions for any of our guests in one of two ways. You can go to the city's website at www.hamilton.ca/askcovidquestions, or you can reach us on Twitter by tagging at City of Hamilton in your tweet. And once again, this evening, our staff, they are monitoring social media and the City of Hamilton website, and we will get to as many of your questions as time allows. Of course, we get hundreds of questions each week, and we do our very best to answer as many of them as possible. We thank you all for submitting questions, and we hope you will continue doing so over the coming weeks as we continue our virtual town hall presentations. With that said, Mr. Mayor, as we usually do, perhaps you can begin by giving us a brief update on how things are going here in the city of Hamilton as it relates to COVID-19.
Thank you very much, Mike. And as usual, thanks to Cable 14 and CHML and everyone watching and those that are calling in with questions. Much appreciated. Hopefully we can share some information with you that'll be useful. We are pleased with the response from our community, and certainly I am, as we gradually reopen our city in very, very measured small steps. The majority of our residents are abiding by that physical distancing measure that we keep talking about. Remember, the virus is still in our community. Our state of emergency is still in effect provincially, as it is in the city of Hamilton. So to remind you that washing your hands, sanitizing frequently touched surfaces and items, wearing non-medical masks as an added layer of protection when physical distancing is difficult to maintain, all of those measures are still very important for you to continue to do as we work through this process. So please keep up the good work and maintain the smart posture out there, which is protecting yourself and protecting others from, spreading the virus in our community. Some great news from our Public Works team today, as I'm pleased to share that the city is starting up our regular weekly leaf and yard waste collection on Monday, May the 25th, so next Monday. So back to the regular schedule. So if your garbage day is Monday, then put your leaf and yard out on Monday, Tuesday, same thing, et cetera, et cetera. So glad that we could have the HR issues sorted out to be able to have the person power to be able to pull this back together again and provide that regular scheduled waste collection service that I think many people have been anxious to have us put back into place. And thankfully, the issues have been worked out, and that's happening. And speaking about Public Works, this week is National Public Works Week, and I'd like to recognize all of the Public Works staff who support our city and community through the planning, building, operating, and managing our city year-round, but even more so during this pandemic, where they have been actually the frontline workers keeping our city functional, both maintaining our roads and streets and sewers and water wastewater systems. All of that requires attention and work, and all of those workers have been working right straight through. They haven't been isolating at home unless they were sick. They've been out there on the front lines, picking up the garbage, doing the leaf and yard collection, maintaining parks, maintaining roads, sidewalks, water, sewers, the entire system. So critically important, and we want to highlight and thank all of our public works employees for their ongoing work all the time, especially during this pandemic process where it's been a particularly stressful and difficult time to keep our city running smoothly. Back to you, Mike, on other questions.
Mr. Mayor, thank you very much for starting things off. And we will now be moving to Dr. Richardson. And Doctor, as we usually do, we'd like to get a brief update from you on how things are sitting in our city right now related to COVID-19.
Absolutely, Mike. So today we're up to 602 cases in Hamilton as of 9 o'clock this morning. 595 of those are lab confirmed and 7 probable. Of the 602, 397 cases, or 66%, are resolved. We've seen some, large increases in cases, as well as that drop in percentage that have been resolved because of the large outbreak that we saw happen at the Roslyn over the last week and the weekend. So that is the prime driver of the changes in the numbers that we've seen. We have reached, unfortunately, 30 deaths to date. There were 3 new deaths today that were reported, unfortunately, all associated with the outbreak at the Roslyn Retirement Home. An 84-year-old gentleman who passed away on the 18th of May, an 86-year-old on the 19th, and another 80-year-old male again on the 19th of May. So our thoughts go out to their family and friends who have lost a loved one to this virus. Unfortunately, again, this is the group who is particularly vulnerable to this virus in terms of getting sicker related to it and even dying. Those who are over age 65, those who have chronic conditions, they really are the most at risk. And unfortunately, we have seen a number of deaths associated with the virus. We currently do have 12 institutional outbreaks, none that are community-based, and there are many more details about those on our website. The majority of those, though, are just 1 or 2 people who are still associated with all of the testing that we did in long-term care homes, and so they're not larger outbreaks of the sort that we did see at the Roslyn. So the majority of them are smaller. That's it for now, Mike.
Okay, Doctor, thank you very much for that. And we will now continue on to Mr. Paul Johnson. Paul, as we also like to do with you, my friend, and regarding what's going on with the EOC, the Operations Center, would you mind giving us a brief update since anything has happened since last week?
Sure. Thanks, Mike, and good evening. Lots happening. I mean, the EOC continues to work each and every day on a number of issues and responding to what have been a number of announcements over the last few days provincially as the province moves into what the province is describing as stage 1 of reopening. And so alongside all of those announcements, which we've been making over the last week, there's always the operational pieces that happen behind the scenes. And I want to, begin tonight by thanking again, as the mayor did, all of the folks that are delivering service on our front lines and continue to deliver those services. And when changes come and things happen provincially, are the ones that are out there then trying to figure out how to comply with those new directives and new directions. And I'll talk a little bit more of that in just a second. I did want to start tonight by talking about personal protective equipment and assure the community that in many cases we are in a very solid position now with our PPE in terms of surgical masks and face shields, gloves, and we've switched a lot more to reusable gowns, which allows them to be laundered and used obviously multiple times, as the name suggests. We are in a very, very strong position in terms of those supplies, and we have more coming in. So I'm feeling very comfortable about that, and I really want to thank our team in the logistics section of our Emergency Operations Center for all the work that they do in procuring and working with our procurement department and working with finance to make sure that we have the supplies in place. The staff that we talk about each and every week going out there and doing their job will only continue to do that and will only feel supported to continue to do that if they're properly protected. And so I'm really pleased to say to everybody that we're in good shape on that front. And also, I think it was a couple of weeks ago, we talked about the announcement, the mayor made the announcement that school boards and libraries were working together to actually print in 3D printer land, face shields and mask bands. And I can tell you that we're actually using those within our long-term care facilities, within our fire department, and in fact delivered some of those to 6 nations. So it continues to be not only everybody in it together in the city of Hamilton, but we also, of course, work with our partners for that. The one area of concern with PPE continues to be those very medically necessary masks, the N95 masks, and in some cases with our paramedics, we use what are called the North 7700 half masks. They have a little filter puck in them, as people may have seen our paramedics using them. They have a little bit of a longer life, but in both cases, those supplies are a little thinner. We are good for a number of weeks there, and we have contingency plans in place, but we continue to scour the universe, as does everybody, to try and make sure that our N95 supplies or these masks with the filter pucks in them, that those supplies remain steady. They are an incredibly important defense for those folks, sometimes in long-term care, sometimes in our paramedic service, who need that level of protection when they are working with individuals in healthcare settings. And so a lot of people have talked about them. We've asked for donations around them. Sometimes it's tricky with the N95s because they actually have to be fitted perfectly to someone's face, and different people have different masks that they need. So there's actually a number of masks. It's not just one brand and one kind. We actually have to do this fit testing and make sure that it does fit as best as we can for the people who need them most. So it's a big of a challenge right now. We continue to want to build up our supplies, and we also know that as the province reopens, particularly in healthcare, and we get back to elective surgeries and other work happening in the healthcare sector, that it's going to be a challenge as more people need N95 masks and they're already in short supply. It's going to continue to be a challenge. So we have our eyes on that. We have a number of irons in the fire, as they say. And again, kudos to our teams who are working day in and day out to make sure we have the right supplies to keep people safe. There have been announcements about the opening of new amenities within parks and within the community. The good news is some of this stuff we've already announced and we're underway with. I talked to our golf operations folks today. As you might imagine, Kings Forest, we had an incredibly busy full day of golfers, our first day at the municipality of opening a golf course. And I have to say, kudos to those who thought through how we were going to handle this. We have to do an education. People have seen some of the requirements around golfing, but of course it's always when you arrive that you see whether it works or not. And we had additional staff that were greeting golfers as they drove up and indicating before they even got to the parking lot and started to unload their equipment what the new regime would look like and what the new rules look like. And I can tell you that today we had just a tremendous day. The golfers were happy to be on the course and happy to abide by the rules. Our staff did an awesome job of getting the course ready and getting our facilities ready. And I saw photos of things like the protective shields that we put in place where people pay for golfing, and all done extremely well, all done within a few days. So I want to give my hats off to that. We're continuing to do some work to open other amenities, tennis courts, some of the picnic areas, the benches, and some of those sports fields that are in parks that now can be used what they call passively. So no leagues. For those who have a baseball league and are thinking, oh, by Saturday, let's get out and start playing the baseball league. No, this is not for organized sport. It is for people to use these facilities in a passive way. We're going to need a few more days. When you think about all of those amenities, we have a lot of work to do. But the other big one that we're looking at is we're getting the nets up for tennis. These are sports that are by their very nature inherently physically distanced, and it's going to be great to get some of that back, including pickleball, which I know is a huge sport in our community. So all I'll ask is for Hamiltonians to be a bit patient. We are working as fast as we can. You can understand that we have lots of parks and lots of amenities. We have to get it done right. And we also have to have the signage and the rules in place so that people can use it safely and they know clearly what they need to do. And when I look at how golf went today at Kings Forest, and of course later in the week, we'll have the two courses at Shadoke open. When I see how smoothly that went, that's why we take a few days to make sure we have everything in place. So that's a big part of what we're thinking through right now, Mike, and really happy the way the team is working hard to allow people to do more as we venture out just a little bit more from our houses and try and do it in a safe way.
Well, thanks for that update, Paul. And I do just have a quick follow-up to that, if you don't mind. I know there are some recreation tennis courts that are out there. They also share some basketball nets. Based on physical distancing, and if there's a couple people within your household that want to go and maybe shoot some hoops, do you see that being permitted at some point?
We do, and that's part of what we're going to be looking at, ensuring that people can get out. And again, this will not be to organize a game and send out the emails to all the buddies and say, let's meet at the park and play a great game of 3-on-3, 5-on-5 basketball. That's not what this is about. It is about taking that basketball out and shooting a few hoops. And I could drone on about the importance of basketball for a good 35, 40 minutes, but I'll leave it at that and say that all of these amenities that are there that provide people an opportunity to get out and enjoy some sport. We want to do that, but we have to make sure it's done safely. And we want to make sure that when people arrive, they know what the rules are. We can't have staff there all the time. So we have to get the signage ready. We have to get it up. And as people can imagine, an announcement on a day, it's just impossible for us to turn it around super quickly. So over the next couple of weeks, you're going to see repeated announcements about things that are ready to be open, ready to go. Some of the easier ones, of course, are the off-leash dog parks and things like that, which are really about just changing some signage and taking the lock off. But some of these will take us a little bit of time. And so we expect to see, single people or, a parent and a child shooting hoops in parks, people using some of those amenities. We want that to happen for the good of our mental health. And obviously, we want to use the good weather months that we do have in this country to our full advantage.
Wonderful. Thank you very much for that, Paul. Do appreciate it. Dr. Richardson, we're going to head back over to you now. And obviously, the situation at the Roslyn Retirement Home is very concerning. How is public health helping to manage the situation and help to prevent from this happening at other retirement homes?
Absolutely. The situation that we saw unfold with the Roslyn is understandably quite concerning for everybody. Most especially, of course, for those that are involved, the residents in the home and their families, and as well for the staff who are working there. Nobody wants to see a retirement home and all the people in it go through a situation such as that. And we've been working hard to support these homes to try and ensure that this sort of thing doesn't happen. So there's been a lot of work that's been going on. We had started with doing assessments in these homes, over a month ago, making sure that they had infection control precautions in place. And the province as well had issued some directives to hospitals to work with long-term care homes as well as retirement homes to support them. And so doing assessments to see where they were at in terms of staffing plans, infection prevention and control plans, looking at whether they were having any challenges at all. And so, that's been going on in Hamilton as it has been across the province with the long-term care and retirement homes, as well as hospitals, public health. They're regulators. So in the case of long-term care homes, it is the Ministry of Long-Term Care who is the regulator. And in the case of retirement homes, it is the RHRA, or the Retirement Homes Regulatory Authority. So all have been working together to do those assessments. And we've been redoing them actually in Hamilton again. We've continued to improve the tool at the provincial level. And so we were going back in through all of these homes another time. And unfortunately, though, this sort of thing does sometimes happen. And we had an order with this home in terms of making sure that they were following those measures, and they had demonstrated that they had done that. But we do know that in these sorts of situations, in these sorts of homes where we do have vulnerable people living there in a setting where they're tightly living together, perhaps watching TV together, as well as sometimes having some joint dining together, that there are challenges, and they aren't set up the same way that a long-term care home would be in terms of having what we call registered staff, nursing staff there, and people there overnight. They're just not set up to manage outbreaks and monitor people. These are essentially independent living adults who need some supports that are largely provided by the LHIN. And so it can be challenging. And we know that staffing across all of retirement homes and long-term care has been challenging. And we've heard the provincial ads that are on the radio looking to attract people to all the positions that are there. So unfortunately, it does happen. We do find that once homes do get in a situation where they have cases, they can, if they don't have all those supports in place, things can unfortunately move fairly quickly, as did happen in this case. So at this point, going forward, we'll continue to support all of the retirement homes and the long-term care homes in the ways that we have been, and working with the regulators to do that. For the Roslyn in particular, we don't know when they might be able to have residents back. The regulator will have to, will have conditions for them that they will have to meet. We do continue to have an order in place for them in terms of infection prevention and control and what our expectations are there. For instance, the place needs to be thoroughly cleaned with appropriate cleaning agents. They do need to make sure they have sustainable staffing, PPE on hand in order to do good infection control. And so all of that would need to be met. One other thing just to note is, just as we've been going through, we'd heard when interviewing people, retirement homes are not meant to have visitors in them, just like long-term care homes. But under some circumstances, essential visitors are allowed. And we don't have a list of who might have visited the home. So we're just reminding people that if they were visiting in this home, if they were an essential visitor in this home, that if they were there between the 26th of April up to and including the 15th of May, to self-isolate for 14 days from the time of your last visit. And of course, anybody who is in the home who is symptomatic, they need to be assessed, and they should call our public health hotline at 905-974-9848, sorry, to book an appointment at the assessment center. So we did just want to underscore that in relation to the Roslyn as well.
Dr. Richardson, a follow-up to that, assuming that the Roslyn Retirement Home does reopen, two parts. Will they be under some stricter measures to ensure that they meet and exceed on a daily basis? And second of all, you alluded to no sign-in and sign-outs for people. Is that something that might be considered to be implemented as they move forward?
So we'll continue to talk about this one. Ultimately, it's up to their regulator in terms of all the any conditions that they put on this home related to the care and the functioning of it. But we do talk with them on a regular basis to discuss and make recommendations in that regard. And then in terms of our own infection control practice recommendations and requirements, we'll be making sure that those are in place, and we'll continue to monitor the home closely.
Great. Thank you very much, Dr. Richardson. Do appreciate that. Mr. Mayor, we're going to head back over to you now. City Council got together one more time for another virtual meeting. This is they've been doing this for several weeks now. Is there anything that residents should expect as these virtual meetings continue? And also, were there any key outcomes related to COVID-19 that came out of today's council meeting?
Thanks, Mike. Yes, these virtual council meetings are likely to be with us for quite some time, as long as there is a restriction in place by order of the province of no gatherings of 5 or more. Then we're going to be adhering to these kind of virtual meetings for city council. And today as well, the council directed the city staff to begin the process of developing a way to get the planning committee and the committee of adjustment and the heritage committee and its associated working groups back into a virtual meeting process, so that we can kind of clear up the backlog of planning approvals as well as committee minor variance approvals that comes out of the committee of adjustment. Some 100 minor variance applications are sitting there waiting to be resolved on some of the issues that people have made application for and want to get on with the work, so they need a minor variance. And planning applications. I think there are some 25 at the moment that are needed to get processed, and we want to get that ball rolling. So instructed staff today to get busy giving us a plan on how we can do that by maintaining, again, the public delegation portion of the planning process that is required when you're making approvals on planning applications. And so it's going to be a bit of a tricky process. How do we do that in this kind of COVID environment? Do we do it by letter only, or by video, or direct video? They participate in a portion of the meeting. We're going to have to figure that out. But there are statutory requirements for public delegations, and that's the challenge that staff are going to bring back to us, I imagine, sometime around the June the 3rd, so that we can get busy covering this backlog of planning processes and committee of adjustment applications that need to get done. Also, and this is quasi pandemic related, Sobe Bike, or the Uber, who actually manages Sobe Bike system on our behalf, indicated that they're going to not carry through with the contract that they currently have with the City of Hamilton to operate that system, which is bad news. It leaves some 26,000 active members potentially in the lurch, and clearly they indicated that by June the 1st, they're not going to continue to operate. We want to hold them to their contract, which runs for another year or more. But in failing that, we're going to have to figure out a way to either maintain this facility or figure out what we're going to do in terms of the 900 bikes that we own and the accompanying racks that we also own. So we own the kind of capital portions of this facility, and they have an operating system and a membership list that they own and operate. So we're going to do everything possible, in my view, to try and maintain this very valuable mobility system, especially in the lower city downtown area. And there were certainly plans of creating that ongoing expansion. It has been very, very well used. And again, I say there's 26,000 members. So we're hoping that we can find a way of continuing on with this valuable resource beyond what the contractor is prepared to do. So short timeline, not much notice. We're going to have to do some quick work. And hopefully by next week, virtual council meeting, we'll have some indication of what's possible in terms of how do we maintain this facility.
No doubt, Mr. Mayor, a shock to everyone. I know we could probably do a full hour just on that topic alone. I know we're coming into the summer months for council, and these virtual meetings will continue. Will we continue on with a regular council schedule, or as in the past, will we just be looking at doing, I think it's 1 or 2 a month on a Wednesday morning, something like that? Any discussion on that at this point, Mr. Mayor?
Well, given where we are, I expect that we'll probably be doing more committee meetings through the planning committee and committee of adjustment, planning committee specifically. There's a backlog, and that's going to require, a significant amount of meetings. The summer schedule is always a challenge because people are likely still to want to take vacations, whether it's staff or counselors. That's still an issue, but we haven't made a decision yet on what that summer schedule is going to look like. Traditionally, we would have a couple of large meetings and then get them all done in one day, not unlike what we're doing right now, in fact. So we're having basically a committee of the whole and council meeting affirming all of the actions that we're taking all in one day. I expect that council will still do that in the summer months. How often we'll do that depends on the volume of work that we're going to need to do. And I would hope that all of us understand that there's a backlog of issues that need to be brought forward. And that may require some additional meetings that we haven't, not unlike what we've been doing in past summer. So it's not business as usual for a whole bunch of reasons. And so I expect that there'll be some changes in terms of how we operate this summer.
Wonderful. Thank you very much for that, Mr. Mayor. Paul, a question has come in through our web form in regards to when the city will be sharing its plan for reopening facilities and restarting city recreation programs. And a second part to this, what can residents expect and when do we think things will start to open up again?
Wow, lots to unpack there. So let's start. There is a report coming on May the 27th to the combined committee of the whole and council meeting that the mayor just described. It will share how we see services moving through the province's 3 stages. We are in stage 1 at the moment. The province has 3 stages, and we've mapped what our services would look like against that. It won't have specific dates of when X facility will open or why service will be at a certain level, because of course we don't know that yet either. We are watching locally how things are reacting around the virus, and so is the province. And many of the things that we may want to do are still under, as the mayor mentioned, provincial orders. So we have to be cognizant of the fact that even if we wanted to do certain things, we need to wait for those approvals to come from the province. But what we can say is a fair bit. One is, how are we going to ensure the safety of our staff and the individuals who interact with our services on a daily basis? What can they expect in terms of some of the services as they start to come back online will be our expectations of the public, but also what can they expect in terms of how our staff will be behaving and protecting themselves and the public as we go through. And so we'll be able to talk a little bit about that. And that has been a great conversation over the last couple of weeks with public health to ensure that we are being very consistent and clear for our staff some of them will start to return to work over the coming months in different ways, or maybe delivering more services than we have in the past over the coming months. So the public will get a bit of a sense of what that looks like. They'll also get a sense of what are the types of services that will come back on during those stages. And again, we don't know exactly when the stages will be entered into and what other provincial requirements will be around them, but we can give some notional sense of the kinds of things that people can expect in the immediate next phase and in the longer term phase. What people will see in this document is that this is a very slow and steady movement towards not what life was like in January and February, but what we're calling the new reality. I know there's other phrases that people are using, but I think we really like the term new reality, because the reality is that services will remain in some modified form for a long time. And that is going to be driven only by how this virus continues to move through our community and the health advice that we receive about how to make ourselves safe, and of course, ensure that the public has their safety as well. So I know that there's a whole bunch of hope and pent up energy that things will just go back to the way it was. And our message will be that that is a long time coming. And in certain cases, we are unclear about when that will come. The other piece is that there are some larger discussions that will have to be had, not on May the 27th, because you can't do it all in one day. But as we move through the next month or two, some major decisions around how we will continue to operate services that are impacted by this for long periods of time. Dr. Richardson has talked about it. Long-term care has fundamentally changed. And how we operate our two long-term care facilities will need to be changed as well. Things like the way we run our and work with our partners in the homelessness sector or the childcare sector are changing. Some of the guidelines around childcare are coming out. The city runs one childcare center directly, but we fund and manage more than 100 other providers who provide thousands of childcare spaces. And we're going to have to think through what different looks like in some of those services. So it is going to provide a bit of a roadmap, but it is not definitive in terms of dates and times, because nobody can be definitive in terms of dates and times. That will happen as it happens, and we'll respond as we have been in this past week. Golf courses can open, so we move towards reopening. Other things can happen in parks, so we move towards that. Leaf and yard waste, we're now back at a level of staffing so that we can go back to a level of service that people are more accustomed to, putting out your leaf and yard waste on the day of your garbage, and we can get back to that starting next week. So those are the kinds of things that we'll map out for folks, but there are going to be some big areas where there are a lot of unknowns. And I'll come back to the beginning part of your question. When we will fully open our facilities and get back into, for instance, the recreation business of swimming lessons and yoga classes and fitness classes, and the ability to rent our facilities for everything from birthday parties to celebrations to tournaments, those are very much decisions that are going to take some time. You'll notice today that the CFL has been clear to say that they're not expecting to come back until at least September. Overnight camps, we don't operate any as the city, but overnight camps, this isn't the summer for overnight camps. And even day camps, we're not entirely sure what July and August are going to look like. So I know that doesn't answer the specifics of the question that came in, but I think it's a good opportunity tonight to start to lay that groundwork, that our plan is really about how we will react as we move through the phases of reopening provincially, as we move through the phases of understanding more about this virus and what it needs to, what it's doing in our community, and how we can best respond in a safe way. And we believe it's time that, in particular, the mayor and our council know the thinking from the EOC's perspective around this. And also Dr. Richardson will be sharing a perspective that steps back and says, for a community as a whole, forget our city services, as a community as a whole, from a public health perspective, what is the state of this virus? What do we know today? And what do we think is going to be impacting people's lives, whether they choose to interact much with city services or not? What's the impact on all of our lives of this virus? So our council and the community will get that very publicly next Wednesday. We'll have it as part of the town hall after that next Wednesday evening here. And then we're also going to start to do some town halls internally to talk to our staff. As you can imagine, many of our staff are anxious about what reopening looks like. The same way parents are anxious about childcare and returning to school. I get that we're not returning to school this school year, but even worried about the fall and what that means. There's a ton of questions. We need to answer those questions and take our time, and that will be the flavor of our conversation with council and the community, and it will be the flavor of our conversation with our own staff.
Paul, if you don't mind, just a very quick follow-up to that. We are hearing and seeing of some states opening up a lot quicker and being a lot more lax on their rules. Have you been receiving feedback on that? Have you been receiving questions on that, saying, why can't we do what they are doing? I'm just curious what you're hearing out there.
Oh, I hear it all. I hear we're going too fast. I hear we're going too slow. You know, and I even hear a few people say, I think we're doing it quite right. And that's it really is across that whole spectrum. You know, I check in. Dr. Richardson and I talk every day, and I say, hey, can we just go back to normal? And you know, she laughs and then says, no, Paul, we're slow and steady and this and that. We are what we are doing, and it's really the great thing of having a public health unit that is embedded within just the city of Hamilton, and is so deeply connected to a whole bunch of our pieces of work is Dr. Richardson and her team are providing us, though, with some great research and evidence around what jurisdictions around the world have done and what's working well and what isn't, so that we can counter not with emotion and not with, well, we just made that decision, live with it kind of comments, but actually respond with, well, here's why. And the thing about this virus is it is, as I'm learning, different in different communities. And so that doesn't say I'm advocating tonight for this whole regional approach to it. I'm not suggesting that. But what is evident is that things play out differently in different communities. And so the ability of us to continue to get the best information from our public health unit, which is connected in obviously to the provincial public health folks, which is connected into our federal public health partners, allows us to make sure that we're getting the best information. And the pace that we're going at, is it too slow? Is it too fast? I'm not sure that's a question I can answer. What I can tell you is it's not based on emotion and the whim of the day, or how Elizabeth and I feel when we get up in the morning. It's based on what we're seeing in our community, hearing in our community from an evidence perspective, and then that's translated into how we can make things happen. And I'll just end on a practical example rather than the ethereal, but the practical example would be our escarpment stairs. Dr. Richardson and I talked about opening up parks and trails and things, and there was great enthusiasm from her in doing that because of the impact it has on people's mental health and their physical health and all the rest. But she said, you know what, I just want to spend a little more time thinking about how we make those escarpment stairs safe from a physical distancing perspective, from the fact that there's handrails up and down those things, and just yes, they're outdoors, but what do we need to do to make them safe? And I think that's the confidence people can have, is that, again, we're not basing it solely on emotion. We're basing it on the evidence that makes sense for how we can open safely.
Wonderful. Thank you very much for that, Paul. Really do appreciate it. Dr. Richardson, a question has come in from the web, and I'm going to be reading it here directly. With some businesses and workplaces reopening, I am concerned about the possible further transmission of COVID-19. Should I be? And what can I do to prevent myself and others from getting the virus?
Thanks, Mike. This is a great question. And I think one of the things is deciding what word we're going to use for what we're thinking about the future. And Paul's, talked about some of the ways we've been framing it. And, I don't know if it's concerned about possible further transmission, or if it's aware and alert and thoughtful about. It's all of those sorts of things. And we do know we're going to be living with this virus for quite some time. We're a ways off from a possible vaccine or a possible treatment. And so we're going to be figuring out how we live in this new world which has COVID-19 here. So we are going to be looking at reopening, as you've heard about from the province, from Paul just now, from the mayor. And as we move forward, it is not going to be business as usual. And so we have done such a fabulous job as a community, the individuals within it and all of the businesses in it, in adapting and flattening that curve. And we absolutely want to maintain the gains that we have made. And so continuing to follow those infection control practices, the physical distancing measures, the curbside pickup that's gone on, no contact pickups, no contact payment, those sorts of things are going to continue to need to be maintained. The other thing is there's been this discussion now as well about cloth masks. And I just want to draw to your attention to a few things when it comes to those masks, because this is we've been talking about it for a little while. As the Public Health Agency of Canada made their recommendations a little while back, and now David Williams and the provincial government have come out, and we've talked about masks and some of the do's and don'ts around them. And so we're not talking about medical masks, we are talking about cloth masks. The good news is that 2 layers of tightly woven fabric, and I'm talking about t-shirt fabric or the fabric that bed sheets are made out of, or quilts, two layers of that are almost as good as a medical mask in terms of protecting others from getting the virus from you. And remembering that's the primary reason we're wearing those masks. My mask protects the person I'm seeing out in the environment, and their mask helps to protect me. So we always need to be thinking when we're out and about the different ways that we can protect ourselves from this virus. And the best way we can do that is through physical distancing. It is through the hand washing that we've been talking about and people have been doing diligently. It's through the use of the alcohol-based hand rubs when we can't do that. It is about staying home when we're sick. It is about coughing into our sleeve. It is about going out, just one of us going out for groceries. It is about keeping the trips that we're out for to a limited number. And so all of those things are the most effective ways that we can control this virus. And so we're using masks in a situation where we're not able to do that. So if we're out on transit, for example, and in a situation where we aren't able to maintain physical distancing, if we're in a smaller store and not able to do that, then those cloth masks are absolutely something that people should be using. So there's things we need to think about though, because those masks do need to be washed every time they're used, or if they're reusable, they need to be thrown away and a fresh one used. If you're going to be putting on a mask, make sure you wash your hands first. You're going to have your hands up there by your nose and your eyes and all that sort of thing. And so you want to wash your hands before you put it on and then carefully put it on. Make sure that it is snug over your nose, your mouth, around your chin so that it stops any air from getting out and then any virus droplets from getting out. When you come to be out and about, try not to touch the mask. So if you find your mask doesn't fit well, that it isn't comfortable, then go find another one because you're going to be in it for a little while. And it is something we don't even notice in terms of looking to adjust something while we're wearing it. The other thing is then when you go to take it off, to be very careful about taking it off. And so these masks should have some sort of strap that goes around your head or that goes around your ears. So not touching the front of the mask at all, but rather going to those straps, going to those ties and taking them off and immediately putting them into a plastic bag until you're able to get it washed, or throwing it in the garbage straight away if it's a disposable mask. And when you go to wash that mask, it should be washed in hot water, the way you would wash other laundry. The other thing is to think about who should not be wearing a mask. So we should not be sharing the masks that we have with other people. We should not be putting them on kids under 2 years of age or anybody who's not able to move that mask away themselves, because anybody who's having a hard time breathing needs to be able to remove that mask. And plastic masks should not be used at all. We know with plastic bags and the like that there are concerns about them, adhering to the face and people suffocating with them. So nothing that isn't breathable, like the t-shirts and the kind of linens that we've been talking about, should be used as a mask. And again, we are asking that we're using those sorts of masks when we're out and about, and leaving the medical masks. You've heard Paul talk about PPE and the challenges we continue to have with masks for healthcare workers. We need them, especially for healthcare workers who are exposed to the virus with people who are sick and are looking after people who are sick, and need the confidence to know that they're well protected in their work as they do that very important work. So just a few extra things wanted to highlight about masks as we're going forward, and encouraging people to find a way to use them in situations where they're not able to physically distance.
All some excellent points, and thank you for illustrating those so nicely, Dr. Richardson. It's appreciated. Paul, we're going to head back to you, and as we alluded to, we don't know when this COVID-19 will be ending. Not going to be anytime soon. It will extend into the summer. The question has come in regarding the city and its usual cooling centers like rec centers, libraries. Are they going to be open for the summer? I'm even going to throw in there splash pads because I know that's a relief for a lot of people. Or what other plans are in place to offer relief heat this summer for those who are most vulnerable?
So the first thing I'll say is we're working on a plan so that we can respond. We won't allow this to be a situation where there isn't a response in place should we have heat situations where people need to cool off. We're a little unclear about some of the things you talked about Splash pads decisions still pending on that. We're looking at facilities. We would, in a pinch, have the ability to open up some facilities. We'd have to make sure that we've got all the physical distancing in place. But if we really needed to, and thankfully, I look at the weather in 14-day increments to make sure there's nothing sneaking up on us that we need to be aware of at the EOC. And it doesn't appear we're going to hit a heat alert situation in the next couple of weeks. But if we had to quickly respond, we would do so. But we are developing that plan. Folks continue to meet on it. They had a meeting on it today, and so we're going to put together something. It'll be, part of the discussions and the announcements we can make in the next couple of weeks. But we are waiting on some of these elements because a big part of what we've been using in the past as cooling opportunities for people are splash pads, are public pools, and extending hours or ensuring that they're on at the right times. And we're not entirely convinced that those will be as available to us as we may need. So we're looking at some contingencies, but we want to let the community know that if we were to run into that situation, even a little earlier than getting all the other answers, we would ensure there is some kind of a response that would allow people to have places that they could go to be cool, but also places they could go and be safe as well. So it'll look a little different, I would expect, this summer because I'm not sure some of those amenities will be open in the same way. But as always, we'd be able to respond, and more to come on that next week.
Maybe if I can just follow up with that in regards to swimming pools, Paul, there are multiple apartment facilities in this great city of ours that have outdoor swimming pools. I know they're not city owned, but are there going to be regulations put in place on whether those can even be opened as we move forward?
I expect there will be. We don't have all that guidance, but a bit like the play structures and some of the amenities, when that order came down, it applied to private pieces as well. So private condominiums had to close down play structures and outdoor amenities as well as publicly owned assets. So I would assume that it would cover both. I can't imagine we'd be in a situation where, private pools in large settings would be there. In terms of individual residence pools, different story, but in terms of condo complexes and things, I would assume that they'll apply in the same way, but we're waiting for some of those. You can see that there's just a little bit of time being asked in terms of patience by the public to get the rules in place and see whether those are the types of activities that we can get to in the summer. And the one that I'll toss in the mix around that is the day camps in the summer as well. That although there's a desire to be ready to do it, there was very clear indication from the province that it may change. And the answer may still be, as we get closer to July and August, that no, we can't do some of these activities. And again, that will be based on the surveillance and the monitoring of how the virus is affecting communities. And because it's not going away, our job collectively is to make sure that we're on top of those numbers so that we can make the best decisions. And so people will just have to wait a bit on the public pool side of things until we can be assured that it's done in a safe capacity. But I can't imagine it's going to come back at the same volumes. I think the other piece that I keep sharing with folks who ask is, for most activities that were congregate in nature, expect that there's going to be a much lower threshold in the number of people that can attend those, particularly in the short to medium term. And then as we get further into the fall and into the next winter, maybe some of that will begin to relax. But in these early stages, I just don't believe we'll see the same volumes of people being able to access these if they open at all.
Of course. Thank you very much for that, Paul. Do appreciate it. Mr. Mayor, we're going to head back over to you now. How is the city working with neighboring municipalities to ensure coordination in reopening and, of course, recovery?
Well, thanks, Mike. Before I do that, I want Paul Johnson to show off his referee's basketball mask for us right now, because he thinks basketball is the best team game in the world. He might be right on that, but he's actually quite a good referee.
So I think I have to talk. So I get on camera. But as you can see, it's the stripes. If you're an official, stripes are your uniform. And thanks, Mr. Mayor, for the opening. And what I will say is, one of the things that's happening across a number of areas, including our own community. In this case, this was a North American Association of Sports Officials, but these masks are being made, and with everyone that's purchased, obviously mostly by officials, one is donated to healthcare as well. So it's those opportunities, and I know we've shared some of those good news stories in our community about people doing it. But yeah, I love my stripes when I'm on the court, and if I can't get on the court, I might as well wear it on my face.
I haven't seen it on your face yet. So you're not going to show it off. Is that what you're saying? Oh,
well,
I'm going
I
to
think
talk.
I think I got
on.
So how do I? So I think I need to talk a bit more here, Mr. Mayor,
All
and
right,
get myself on the camera, and then
I'll get you at the end for sure.
Yeah, you bet.
And you know what? And I'm so happy that tennis is also starting to happen. I've been bugging Paul and others about there's a large army of tennis players out there that can physically separate. And all anxious, and I'm really tired of hitting that ball on the elastic. I have to tell you, or the ball against the wall is just not the same. And so I'm sure lots of people are anxious to get out there and play that tennis. So that's happening as we speak. The tennis court nets are going up. You asked me about cooperation between local mayors, and we had a meeting with the mayor of Greater Toronto Hamilton mayors. So Toronto, Hamilton, Mississauga, Barrie. Brampton got together and basically decided that we were going to follow not politics but science and data and public health recommendations in terms of how we proceed on the things that we can control opening up. I think that's going to be a very important element, and I think Paul talked about it. I think the doctor talked about it as well. We should not get political about this. There are lots of things that we could probably make people feel good about, but it may be exactly the wrong thing to do. And we're already somewhat tenuous on whether or not we're going to see additional cases going forward based on what's opening up here. Some anecdotal information today already in terms of increased numbers across the province. So those are areas that we're going to have to be concerned about, and people should anticipate that this summer is not going to be your usual summer. It's going to be different. We don't know to the degrees to which it's going to be different, but expect and prepare for a different kind of summer that we've had over the the many decades that we've enjoyed these glorious summers with all the services that are available. So it's not going to be the same. We've also, as asked for assistance from our federal and provincial partners, and the good news for our large urban mayors caucus in Ontario is that we've got the federal prime minister and the premier to agree that it's time to have a conversation with municipalities about the assistance that we're going to need as municipalities based on the huge financial hole that we're creating in all of our communities right across the country and specifically in Ontario. And so we're asking for an active discussion, active consideration of some of the asks that we've had out there across the country through FCM, and demonstrating the need that the recovery is also going to depend on what we're able to do as municipalities and what kind of services we're able to maintain and what kind of finances we're able to offset to ensure that we're not downloading all of these costs to the taxpayers that are already being challenged. And in terms of recovery for municipalities, the issues around transit are going to be important. We're going to be required and probably want to deliver infrastructure projects to add stimulus to the economy. There's going to be a huge need for childcare, especially when kids are out of school right now, and we've got lots of parents that are coming back to work. What's the childcare situation going to be like? How can we help and assist in that area? What can the federal and provincial governments do to help us? And obviously the virus and the caution around what we do on a day-to-day basis, both now at work and in terms of the businesses that are opening up, is going to be present with us for quite some time. And I'm not going to put it into years, but the numbers you hear is anywhere from to the end of this year to well into next year. So prepare ourselves. It's a sad reality, but a reality nonetheless. And I think we would be doing a disservice to our community if we weren't realistic about the expectations of what this community is going to be like, not only here, but right across the country, right across the world. In fact, the kinds of changes that are going to occur until such time as a vaccine is available and distributed and administered to provide protection against this virus. So I just want people to prepare themselves for a different kind of summer than not the ones that we've enjoyed in the past, and not the ones that we want to continue to enjoy in the future, but one that's likely to happen this summer, which is going to be radically different from the summers that we've had previously. So we're working with all the levels of government to ensure that we're getting the resources we need as municipalities. Our transit systems, by and large, are operating for free. It's generally a huge revenue source, 50% subsidized by the fare box and 50% by the taxpayers. And now it's 100% subsidized by the taxpayers, and that adds a huge additional burden to our municipality and all municipalities that have transit systems. So we're asking for assistance, and to restore that transit system is going to take a number of years. So, you don't get your ridership back right away. It's going to be a challenge getting the fee structure back in place at some point. It can't remain free forever, I don't think. That would be a huge, cost to have to absorb. But obviously, there will be a discussion around that into the future. But things are changing, and they'll continue to change. And I know that our operations team and our public health team are going to give us the good advice as to what we should do and how we should do it on the things that we can control as a municipality. We are also appreciative of the fact that the premier is also taking a very cautious approach. And you mentioned earlier about what's happening in the United States. I'm not sure that we ought to be modeling their approach, because we're already seeing indications of areas where the amount of cases that they're having is starting to increase significantly, and I don't think that's acceptable in any way, shape, or form. And I don't expect that to our process to mirror what's happening there. We need to develop our own, and there are lots of examples of how we can do it right.
Mr. Mayor, thank you very much for that, Paul. We're going to get one more question here before we throw it back to the mayor for his closing remarks. And the question that has come in is, I'm seeing HSR drivers and passengers wearing masks now. Is it mandatory for them to wear masks? And should passengers also be wearing the masks? You got about a minute or so, my friend.
Yep, short answer is not mandatory. Second part to the answer is strongly recommended. Not only strongly recommended locally, it's now becoming a stronger recommendation provincially and nationally, as we heard today. So I would encourage everybody to, if you're going to use public transit, or you're going to be in a situation where you can't physically, or you don't think you're going to be able to properly physically distance, to, again, using all the right techniques, don that mask. And just so everybody understands, I've been showing off a mask tonight. I will also be putting this right away into the washing machine and cleaning it as I should. So we are asking users to mask up, but obviously we're not making it mandatory at this time.
Wonderful. Thank you very much for that, Paul. And I know it was mentioned last week, and I will also say it. Kudos to the HSR drivers and everyone running our transit system, keeping our city moving. With that said, thank you to everyone at home for your questions tonight. And before we go, as we normally do, Mr. Mayor, I'd like to give you the final word as we move forward regarding COVID-19 here in Hamilton.
Thank you, Mike. And I'm going to insist that Paul Johnson show off his striped mask before we leave the broadcast here. So get ready, Paul. Enough of the heavy stuff. I want to get to some good news items and some thank yous. So, of course, we thank our American Sign Language champions, Rosalie Visers and Georgia Whalen. Had a mental blank there for a second. Thank you for your ongoing work, and of course, CHML, Cable 14, and everyone that's tuning in. Some good news stories, coming in from us, and we're asking every week for people to send in their good news stories to mayor@hamilton.ca. A quick shout out to organizations that are doing some amazing frontline work. So to the Dundurn Market, they've launched an Indiegogo project selling Clean Hands and Open Hearts t-shirts. They cost about $27, and some of the proceeds from each sale buys a food box for one food bank family. So go to Indiegogo.com for information, and congratulations to Justin Ebbis and Roger Ebbis and their team at the Dundurn Market. And a shout out to the team at Orbis Communications. They're a John Street South IT business that launched a campaign called Operation Take Care of Each Other. They partnered with local establishments such as Salty Espresso, 193 Bench, Royal Pizza, Burnt Tongue, Blend Catering, and Terra Nurseries. And over a 5-week period, they collected some 500 bags of fresh produce, 400 containers of soup, 300 individual meals, and 150 pizzas. And it was all to the benefit of Neighbor to Neighbor Food Bank and the frontline workers at St. Joseph's Healthcare. So thank you to all of them for their ongoing work. And again, continue to send your good news, good things that people are doing in the community to help one another, whatever it might be. Send it to mayor@hamilton.ca. We'd like to be able to share that good news on our broadcasts, whether it's the town hall or at the media briefings coming up on Friday. Thank you to all of our partners for pulling this broadcast together as usual, and thank you to Mike for hosting us as well, and thank you to the community at large for keeping up the good work. And again, I was out and about over the weekend, and by and large, everyone's doing what they're asked to do. Again, that'll be an ongoing process, and even though a lot of facilities are now starting to open up, be smart about how you use them. Stay away from the crowds. Find your own place and space, and make sure that you get out and enjoy some of these facilities. But do it safely and do it under the recommendations of our public health. If we do that, then we're going to be able to get through this together as we continue to work on stopping the spread of this virus and working towards opening up our community each and every day to make it a little bit better for everyone to enjoy. Thank you, Mike. Back to you.
Well, thank you very much, Mr. Mayor. We want to remind you that the city continues to accept donations of personal protective equipment to provide much needed resources for the citywide response to COVID-19. Of course, the equipment will be provided to frontline workers, emergency responders, and other healthcare professionals. The types of equipment that will be accepted, they include surgical masks and N95 masks, impervious gowns, gloves, face shields, and other eye protection, swabs, alcohol-based hand sanitizer, and powered air purifying respirators. The city is requesting these items from local healthcare providers, pest control, hospitality providers, nail salons, and construction companies. And as we say every week, homemade equipment will not be accepted. If you have equipment that you would like to donate, email ppe@hamilton.ca or call 905-546-2424, extension 2257 for more information. We want to thank our American Sign Language interpreters and, of course, our production team for making tonight's town hall possible. Thank you for watching and listening on Cable 14, 900 CHML on the City of Hamilton's YouTube channel and on our toll-free number. We ask that you please continue to monitor all of our local media outlets for the latest news and updates from the City of Hamilton. And of course, we will be back again next Wednesday night at 7 p.m. to answer more of your questions. Hamilton, stay safe. Look after yourselves. This is the new reality. I'm Mike Fortune. Good night.